I'm here with one of our patients, Jordynn, who is actually a, nurse practitioner. So she has lipedema, and she actually works in the healthcare field. And I thought this would be a great opportunity to hear from someone who understands the condition, not only from a patient suffering from it, but also being a healthcare provider, considering that she has medical insight. And it's nice hearing from someone else as opposed to hearing myself. Um, so with that, I'll let Jordynn, if you can just introduce yourself and just let us know, why you went into nursing.
Thank you, Dr. Saeed. So yes, my name is Jordynn Odin. I'm a board certified family nurse practitioner. I have been in healthcare since I was 18 years old and also suffering with lipedema since about that age when I got pregnant with my first son. I got into nursing because my grandmother and about 8 other family members are nurses, not only growing up around it, but the care for the patients is really what drove me to be a nurse.
And you took that to the next level, right? Now you're a nurse practitioner, and
Yeah.
you can
Yep.
find your own and
Yep.
see patients on your own without any supervision. So what
Right.
what made you take that extra step?
I wanted to be independent in my practices. I have also the idea of helping patients with lipedema in the future because it's something that I've struggled with. And knowing that there's not anybody in upstate New York where I live who practice with lipedema, I thought that I could help patients with the issue that I am also dealing with, not only emotionally, but giving them advice on compression garments, pre and post ops advice, and helping them through the process.
Yeah, I mean, like I tell patients, there's so many ways to do things, right? There's different compression garments, there are different approaches to surgery that we all have. We talked about drain sites being left open or closed. And a lot of times that tells you, like, if you see practices that vary across the board, it's a lot of what it is and what works for that patient or that surgeon. It means there's probably not like only one way to do things.
Mhm.
So, and just like one garment might work for one patient, it might not work for another. So we'll get into all those things. And I think having you and, talking about this stuff is great. So you mentioned you live upstate. So how far away from Long Island do you live?
So it takes me about 4.5 hours to get to Long Island. I am up directly in between Syracuse and Albany.
If you don't mind, if you want to share a little bit about yourself, your family, and
So I am a mom of two. I have been a nurse for almost 9 years now. We enjoy camping and snowmobiling and hunting and all that crazy stuff that we do in upstate New York. I do have one dog named Tucker. He keeps us pretty active. I take him for walks. And we just love living the fun lifestyle of the outdoors up here.
tell me a little bit how did you get diagnosed with them?
I worked with a plastic surgeon up here in Syracuse, and he was a great person, very knowledgeable and very good with what he does. And I noticed that he was doing liposuction on patients, and being around his patients who may or may not have had lipedema, I started getting into questioning myself with my own diagnosis. Is this something that would help me? And going through with weight loss management providers who I have now, I went through weight loss management with medications, diet and exercise, Weight Watchers. I've done it all. And I have realized that maybe there's something more here. So I started looking and using my resources through my nurse practitioner program. They gave us all PubMed and many other references to use for articles that are peer reviewed. And I started looking up lipedema, and the diagnosis is that 1 in 9 women are affected. And that's really what drew me to it, is looking into it, figuring things out. I started doing more research, and I found you on a website for lipedema surgeons, and there's not many for New York State.
So it wasn't just the fact that you felt you were overweight, right? You were having other symptoms that led you to, you know,
Correct.
this diagnosis that not many people, one, know about, not many people may actually acknowledge, even if they know about it, that it exists and that
Yep.
it
Yep.
suffer. So what sorts of things led you to feel that you had this condition? And then you talked about an active lifestyle, right? How did it affect your lifestyle?
So I really started considering something was wrong when parts of my body started getting bigger while other parts of my body were not. And of course, everyone's built different. Everyone gains weight differently. It's based on genetics, diet, your lifestyle. And, for me being active, I started skiing when I was 5 years old. I was an active downhill skier. I was, there's not much I can brag about, but I was a decent skier. And after I had my daughter with my second pregnancy and I went through a huge hormonal change with my body grew even bigger. Specifically for me, it was my arms and my upper and lower legs. And I grew out of my ski boots. And so I wasn't able to tighten them. The constriction of the boots actually felt extremely painful to strap them onto my legs. And when I strapped them on, the um, my fat tissue was so tight and taut, it was like it was going to like burst out of the ski boot, which sounds a little weird, but um, that it really affects me being active. And
I think a lot of women talk about boots, right?
yes,
Not getting into their boots.
yeah.
You have this like a ski boot issue. And like what sorts of symptoms did you have, other than fitting into the boots that you're on? Some patients complain about pain, some complain about bruising, or heaviness that they feel in their extremities. Did you have any of those symptoms?
I had heaviness in my lower legs and my arms. Since I've had surgery with you, I have had less lower back pain as well as upper shoulder pain, specifically on my right side. I've also been able to where, for example, I couldn't even go to the nail salon to get my toes done unless I wore bell-bottom pants because just from me pulling up jeans, just the constriction was extremely painful. I also had scattered bruising throughout my upper arms and my thighs that would appear for I I had no recollection of ever bumping into something and I would appear with bruises. So I knew that there was something different. And then my last thing is I had lipomas on my ankles that were pretty defined. I had ultrasound imaging to rule out to make sure it wasn't a cyst or something else that could be worse. And it was just a lipomas.
You just had surgery, right? We just went through a bunch of procedures. And it's great that we're talking now because you're about a week or 2 weeks from
2
surgery.
weeks.
2 weeks. So it's fresh in your mind how you felt.
Mhm.
So tell me a little bit. You had surgery. This is your second time having surgery, and we're staging things. Uh, Tell me a little bit about what you felt, even considering surgery, and then let's talk about what you felt after surgery.
After my first surgery, which was May 12th, I had my arms and my lower legs done. I I had a lot of drainage. That was something that I wasn't expecting. I knew we talked about having drainage, but I not going through the process myself. I wasn't sure how much drainage we were going to have. I didn't feel bad. I felt a little tired throughout the process. You made sure that my blood work was at a healthy level before letting me go back home to upstate New York, which made me feel better about going home. I started on iron pills, which helped me return my energy really, really quick, actually. And then 2 weeks post-op, we just did my thighs. Throughout the entire process, since I've been home, I haven't had to use any stronger medications like tramadol or oxy or anything like that. I used Tylenol 3 times a day, 1,000 milligrams. And then I used anti-inflammatory medications like Celebrex twice a day. There is some blood thinning properties with Celebrex, but not as much as you'd see with ibuprofen. And then I would use maybe some ice packs and stuff like that, but it's completely manageable.
Yeah, and I think also that everyone has different responses to pain and surgery with the patients that you see and you treat. Some people may use Tylenol for things, and that with the same condition, someone else may need.
Yeah.
So I'm glad that your pain was controlled without a lot of medications. And then, so we talked a little bit about surgery. We talked about your diagnosis. Tell me what things you did for conservative measures, because you've heard about of conservative measures before we go to surgery, and it's usually something that I recommend patients continue after. What sorts of things did you do before, knowing that obviously none of these sort of techniques will completely alleviate symptoms, but what helps you in addition to the fact that you had surgery kind of control the symptoms?
Compression garments, especially when I'm on my feet for long hours. I can't go without wearing my compression garments at work, especially because work in the emergency department, as well as a non-inflammatory diet, I think is very important, and making sure that you're doing low salt.
So when you say non-inflammatory, like what sorts of foods are you avoiding, and what sorts of foods are you sticking with?
I don't completely avoid, for example, dairy. I don't truly avoid it, but I do try to eat it in moderation because it has known to cause inflammation in the body.
And do you feel different, like the days you have milk or ice cream or things like that?
I do feel a lot different.
Yeah.
I try not to eat ice cream if I can help it. I'll try to, I eat cottage cheese once in a while.
Yeah, I
But
feel I feel not great after I have ice cream.
yeah,
Still do it. It's my weakness. So you did diet, you did compression. Did you do anything else? Some patients will do vibration therapy that you've heard about. They'll go lymphatic drainage.
I have found lymphatic drainage massage is not something that I have experience with prior to having surgery with you originally, but it's something that I do think that I'm going to continue post-op. And I think that the techniques that the MLD massage therapist has taught me is something that I'll continue to do throughout the process, not just for post-surgical healing, but it helps with inflammation in general throughout the entire body.
So you did plastic surgery before. Did the surgeon refer patients for manual lymphatic drainage after liposuction? Because actually, many surgeons don't refer patients for
No,
drainage.
no,
They don't
actually,
already,
after I had surgery, I called their office and asked them if they work with anyone post-op to help with the surgical inflammation, and they said that they don't.
many surgeons actually don't necessarily believe in manual lymphatic drainage. It's commonly used in surgeons who do a lot of liposuction and frequent liposuction, and like it really helps with you know inflammation. It helps with swelling. It helps get some of that fluid out, especially if we leave drains. Like the last time for your surgery, we left drains, so it can really help getting fluid out.
Mhm.
Um, what else can we talk about?
I think just bringing awareness to the community because it's not a diagnosis that's extremely popular and it really affects patients, not just physically, but emotionally.
Did you learn about this condition as part of your nurse training, or
I have not.
either in nursing or in NP school?
Nope.
Yeah, so you learn about things like blood pressure, you learn about obesity,
Nope.
but no one spends time really talking about obesity and conditions related to fat
Hmm.
and storage, right?
Right.
Did you talk about lymphedema during?
Yep. We
Yeah,
talked about lymphedema and the need for consistent MLD therapy to help patients with that.
yeah, and there is a component of lymphatic flow issues with lipedema.
Absolutely. And when the
Yeah,
like, if you're, if I didn't wear my compression garments after a long day, most nurses or people who work long shifts on their feet have some sort of swelling. People with lipedema who have more fibrous fat tissue, after your extremities grow and grow, it will congest that lymphatic system, which may lead to a secondary diagnosis of lymphedema.
when patients get into their stage fours and things like that. And I'm happy that you got treated early, because that really prevents you from going to the advanced stages
Yeah.
when we're reducing the tissue.
I
That
had a
we talked about, this recurring potentially
mhm,
around other hormonal changes like menopause.
right.
Mm, but you're aware of it,
Yes.
and that
I
makes
had
a difference.
I had my great grandmother who lost her mobility and ended up with infections. And
And do you think she had?
I definitely think that she had it and my mom has it. My mom is just she's a lot taller than me. I'm only 5 feet tall. She's like 5'8", and she walks every single day, probably 3 miles a day. And she has those column legs that
Mhm.
is starting to have the cuffing around her ankles, and she's a pretty thin lady. And just because, you can have lipedema without being overweight as well,
Yeah.
so not many people know that
What does she
either.
feel about your surgery, or even the fact that you had surgery?
She's happy because she knows that I worked really hard to become a nurse practitioner and I have a lot of life to live. And I'm excited that it's going to help prolong my practice because I'll be able to be more mobile and be able to be on my feet more.
And I think you'll be able to help a lot of people just understanding the condition, even if it's not in upstate New York. I think
Hmm.
all around, just because you have that, you have a different perspective, right?
Hmm.
That additional perspective of being a healthcare provider.
Yeah.
And that makes a huge difference. Would your mother ever consider surgery, or
I think she would.
what would be the things preventing her? Is she, how old is she?
She's going to be 55 in
Yeah.
August.
So I've treated patients in their late 60s, um, and they're hesitant to have surgery, but they're so happy after they get done successfully. And again, we do things much differently with patients like that. As
Hmm.
they can't tolerate as much surgical stress, so we'll go slower. Is the procedure something you would recommend to your mother or someone else that you have?
I absolutely would because I feel that diet and exercise may not work for everybody, and
Yeah.
lipedema can, even if you do manage it with a healthy lifestyle, a good diet, and exercise, there are a lot of people who can get to a comfortable spot with their body, but as soon as they stop, it's going to come right back. And not just that, but as you age and you go through those hormonal changes, not only with pregnancy changes, but pre and post menopause, it definitely worsens the condition. So it will get worse with time. And it's something that can not cure the diagnosis, but it will prevent and or slow down the progression for a while.